19 press briefing, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. Also speaking today are Dr. James Hildreth, President and CEO of Meharry Medical College, and Dr. Cynthia Croom, Executive Director of the Metropolitan Action Commission. We're joined this morning by Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of Public Health, who are here to help you answer your questions. We'll now begin with Mayor John Cooper.
Good morning, Nashville. As we reported on Tuesday, Nashville's hopeful trend in slowing the spread of the coronavirus continues. Yesterday, Metro Public Health reported just 118 new cases, and this morning our new case count is 250. That is higher than it has been in recent days, but our 14-day average remains in the green at 219. But our transmission rate is maintaining a downward trend from 0.86 on Tuesday to 0.81 as of this morning. This is the lowest transmission rate since the beginning of the pandemic. The total number of active cases in Nashville is 3,091. That's down from a peak of 5,856 on July the 20th, a 47% decrease. This is the lowest number of active cases we've seen since July the 1st. And Nashville's 7-day positivity rate is at 11.5%. Now, 15% of floor beds and 13% of ICU beds are currently available. These metrics warrant close monitoring, and Dr. Jahangir will provide more details on all our COVID-19 metrics momentarily. All signs indicate that Nashville's face covering ordinance, the temporary closure of bars, the 9 p.m. closing for restaurants, and the gathering restriction to a size of 25 is effective in flattening the curve of the coronavirus. More importantly, your efforts are making a difference. The hard work and dedication of everyday Nashvillians are saving lives and keeping our economy running. Wearing masks for every trip to the grocery store or postponing your child's birthday party is making a difference. Your sacrifices have resulted in progress. As Dr. Hildreth and other public health experts have said, the pandemic will only end when a vaccine is finally made available. While Nashville's COVID numbers show improvement, our journey to a full economic recovery is just starting. While our 14-day average is 219, our 7-day daily average is 183. This number translates to a metric of 26.3 new cases per 100,000 residents in Davidson County. Now, I'm referencing the 7-day average per 100,000 residents, as this particular metric has developed into a national reporting benchmark. This is the benchmark that determines, in large part, where Nashvillians can freely travel and safely conduct business within the United States. Again, Nashville is reporting at 26.3 per 100,000, and the national benchmark really is 10 per 100,000 to trigger travel restrictions. Now, for instance, several states successfully flattened the recent surge in coronavirus cases and avoided the surge altogether. These states include Connecticut, New Jersey, and New York, and they have quarantine restrictions against Tennessee travelers because our 7-day average new case rate is more than the required 10 per 100,000 residents. In fact, 9 states and municipalities currently have similar restrictions on Tennesseans and all of us in Nashville because of the rate of infection in our state. Now, this benchmark, 10 new cases per 100,000, is the same benchmark used by our own Tennessee Department of Health to determine the acceptable rate of coronavirus transmission for all 95 counties in our state, which in turn determines whether or not it is safe for families to visit their loved ones in long-term care facilities. Currently, 94 out of 95 counties do not meet this standard. Now, to reach this evolving national benchmark of a 7-day new case daily average of 10 per 100,000 residents, Nashville must report less than 70 cases per day for 1 week, down from our current average of 183 cases per day. Now, this is a very important metric to consider in reopening our local economy, but it is not the only metric. But as long as our students cannot safely return to their classrooms, and the state has an every county for itself strategy for the coronavirus, we cannot allow our positive momentum here in Davidson County to give us a false sense of security. Nashvillians cannot freely work or travel to many other states because of the rate of infection in our own community. We must maintain the progress we've made while also preparing for the work that lies ahead of us. Since the beginning of our modified Phase 2, many of you have received a coronavirus test. In fact, during the 4 months that our community assessment centers have been open, Metro has conducted more than 73,000 free diagnostic tests, and nearly half of these tests have occurred within the past 30 days. Since Metro changed lab service providers, we've also seen a marked improvement in test result communication times. During the month of July, the time between specimen collection and state database reporting has decreased from over 5 days to just 1.5 days. This is excellent progress. Nashville has recently seen a decline in our positivity rate. There's also a slight decrease in the number of Nashvillians being tested. The decrease in demand for tests may be expected as somewhat fewer Nashvillians become infected and feel symptoms of the disease. Now, I want to strongly encourage anyone who suspects that they have COVID-19 symptoms or who may have come into contact with someone who has received positive test results, for them to receive a free diagnostic test at the assessment center without delay. Testing is a very important tool in combating the disease. Now, we have heard quite a lot about coronavirus testing over the past several months. PCR testing versus rapid testing, antibodies and antigens, and the importance of reagents and swabs in the testing process. Many of you may still have questions on how the process works, how reliably it works, and why some tests take longer than others. This morning, I want to welcome Dr. James Hildreth, President and CEO of Meharry Medical College, and I have asked him to explain to all of us the COVID-19 testing process in detail. I'm grateful to Dr. Hildreth for his leadership and to the student clinicians at Meharry Medical College for their hard work in staffing all 3 of our Metro Community Assessment Centers. As I mentioned earlier this week, I've met with the police and public health leadership about Nashville's expectations when it comes to enforcement of our public health orders. Any violation of a public health order in Tennessee, including here in Nashville, is a Class C misdemeanor. Last night, Metro police officers issued its first mask ordinance citation, and stronger enforcement measures will continue. I also have a message for anyone who's planning on visiting Nashville in the near future. Traveling or vacationing during the COVID-19 pandemic comes with certain requirements, and Nashville is no exception. If you're willing to follow the rules and respect the health and dignity of those working and living in our community, you are welcome here. Otherwise, Nashville is not the place for you. Our hospitality, tourism, and retail workers, not to mention our frontline healthcare and Metro government employees, are putting their lives on the line to keep our city up and running for our residents and our out-of-town guests with one simple request. You follow our rules to keep everyone safe. Remember, Nashville, don't share your air. The coronavirus can easily be spread, but healthy habits can be contagious as well. Let's all wear masks, stay socially distanced from one another, and encourage each other to do the same. Today is Election Day, and polls will be open from 7 a.m. to 7 p.m. across Davidson County. As a reminder, you must vote at your assigned location, which you can locate by visiting nashville.gov/vote. I encourage all Nashville residents to make your voices heard safely and cast your ballot today. Remember to wear a face covering to keep yourself and others safe. Now, this morning, it's my pleasure to welcome Dr. Cynthia Croom, Executive Director of the Metro Action Commission, who is here to announce the start of the Virtual Job Fair series in partnership with Goodwill Industries, Nashville State Community College, Aegis Laboratories, Conexion Americas, and Workforce Essentials. Now I'll turn it over to Dr. Alex Jahanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. We have added 2 more metrics to the status update on our website, covid19.nashville.gov. The 7-day moving daily average per 100,000 residents, and the 7-day positivity rate. We have been monitoring these metrics closely over the past month, and so we want to make sure they were available for you to monitor them yourself. The number of new cases per 100,000 residents shows how we are doing compared to other counties and other states. 10 or less new cases per 100,000 is our goal. And it shows that this virus has slowed its spread in our community. It's also the number at which you can go visit your grandmother or grandfather or other loved one in the nursing homes. Between 10 and 25 new cases shows its spread is slowing, but not as much as we would like it to be. This morning, we are at 26.3 cases per 100,000. This is much better than we were in the past. A little over 2 weeks ago, we were at 65 per 100,000. However, we still got a bit to go until we hit the number 10 goal. The 7-day positive rate shows that the percent of cases that are positive that were taken over the week prior. When we started tracking this in March, the goal was 10% positive rate or lower because this showed that we had adequate testing in our community and that the spread was stable within our community. Since then, we have tested over 177,000 people in Davidson County. As more and more people are getting tested, going to a 7-day range is a much more accurate way to look at this metric, allowing us to see ebbs and flows in this number. This morning, our 7-day positive rate is 11.5%. To put this in perspective, the week of July 5th, our number was 16.7%. So this is improving. However, we are still not at the 10% goal. These 2 metrics have been added to the roadmap for reopening Nashville status update. You can find an update looking at our website, covid19.nashville.gov. Now some more information. Since our last update on Tuesday, 5 more people have died as a result of confirmed COVID-19. That makes 195 Nashvillians who have been confirmed to have died from this virus. Our mortality rate is at 0.8%. The doubling rate for the virus continues to improve. This morning, it is at 65 days. Last week, it was at 42 days. As a reminder, this is the amount of time it takes for the number of cases to double in our city. The life cycle of the virus is around 14 days, so anything that is above this mark is good, and the higher the number, the better. There are about 190 people currently in Nashville hospitals with COVID-19. While the hospital capacity does fluctuate, the number of people hospitalized for the virus has been steady over the past couple of weeks. Our numbers are looking better, and we are heading in the right direction. And this isn't thanks to you. You have responded and are helping us get this improvement. You truly are your own best advocate for health, so you have to do it. Politely ask others to wear masks. I know wearing a mask is not natural and it's not comfortable, but you have to recognize that it is important and that you still wear one. I know just yesterday there's about 5 people who I actually encouraged to wear a mask themselves. Remind people when they are out, if they're not wearing a mask, that they're not only protecting themselves, but they are protecting their neighbors. If we can get 8 out of 10 Nashvillians to wear a mask, we will continue to lower the number of cases in our city. And don't go anywhere you don't feel safe. If you go to a business that isn't treating you with respect and protecting you, don't patronize them, period. It's very easy. Limit your exposure to others. Wearing masks is one way to do this. And I need you all to continue staying focused. I mean, these numbers I'm reporting today are really, really positive, and I'm grateful to all of you for doing this. I now would like to introduce Dr. Hildreth.
Good morning, Nashville. Today I've been asked to explain to you how COVID-19 testing works. And so the object of all these tests is to determine whether or not the SARS-CoV-2 virus, the cause of COVID-19, is currently in your system or has been in your system. And there are 3 things that can be measured to answer this question. The first is the nucleic acid or genetic material of the virus, called ribonucleic acid or RNA. The second is an antibody that has been produced against the virus. And the third thing that can be measured is part of the virus itself, proteins that are known as antigens. So when we talk about antigens, we're talking about viral proteins. So typically, an RNA test or nucleic acid test is performed on a secretion taken from the back of the nose or the nasopharynx. The antigen test and antibody tests are performed on small droplets of blood. That's what the finger prick is for, to get a small sample of blood to do this. The PCR test takes several hours, a couple of hours to 4 hours to perform when you get to the laboratory. I'll talk about that in a minute. The antigen test and antibody tests can get results in as little as 5 minutes, and those are referred to as rapid tests. So by far, the majority of all tests performed for COVID-19 around the world have been PCR tests, looking for nucleic acids. And this is how this test works. So when you go to the testing center, you will see they will take a swab, which looks like this. And this will be inserted into the back of the nose, into the nasopharynx, because infections start in your upper respiratory system, so that's the best place to sample for actively replicating virus. It's inserted into the back of the nose, it's rotated a few times and held in place for a few seconds to allow the tip to absorb the material. You need to know that this is really not cotton. It's actually a synthetic material called Dacron, and that's because cotton contains natural substances that can interfere with the test. And so that's why synthetic material is used. The swab is then placed into a small vial like this one, which I'm going to show you. And this vial contains what is called virus transfer medium. It's actually saline that contains a protein for stabilization. It also contains antibiotics. And that's really important because the nose, all of us have bacteria that are naturally resident in our noses. They're called normal flora. And we don't want those bacteria to grow between the time we collect the sample and the time we analyze the sample. So there are antibiotics in this vial. So once the swab has been placed into the back of the nose and we collect the sample, it's placed in here, we break it off like this, we seal it like this. It's labeled appropriately to make sure they don't get mixed up. And this vial is then transported to a laboratory where the test is performed. And what happens when this vial gets to the testing center, a robotic machine will take a sample of this, disrupt any virus that might be in there, and they look for the nucleic acids. The technology that's used to find the nucleic acid is actually quite remarkable. It's called a polymerase chain reaction, and it was the subject of a Nobel Prize for the investigator who discovered it. What you do is you synthesize a small piece of nucleic acid that matches the nucleic acid of the virus. That's added to the sample, and then an enzyme called a polymerase makes exact copies of that nucleic acid. And we do several cycles of that duplication. And after 20 cycles of duplication, there's 1 million times more substance than you started with. And that's why the PCR test is so sensitive. Even if there's only a few viruses in the sample, the PCR test will tell us that those viruses are there. So the sensitivity of the PCR test is what makes it special compared to the other tests. The antibody tests are very straightforward, and they've been around for a really long time, for decades, to diagnose virus infections. And what happens is we take a protein from the virus, we stick it to a surface, so that surface is now coated with a protein from the virus. We then take blood from the subject, from the person. We put that blood on the same surface, and if there are antibodies present to those proteins, they stick onto the proteins, and they become trapped onto the surface of the plastic as well. We then put in a reagent that specifically binds to human antibodies, and that reagent has been tagged so we can measure it. It can be fluorescent, it could be enzymatic, but there's a tag that allows us to say that the antibodies were present. And the antibody tests are interesting because they tell us that the virus has been in your system. When we get infected, in a few days, our systems start to make antibodies. It takes some time for those antibodies to accumulate in the blood. So antibody tests are not reliable to diagnose an infection, but they're very reliable in telling us that an infection has occurred in the past. Antigen tests are like the antibody tests, except we're flipping the trapping. The antibody test, we use an antigen to trap the antibody. With an antigen test, we use an antibody to trap the antigen. So we put antibody on the surface, we add blood from the person we're testing, and if there are virus in the blood, which we've lysed, those antigens will stick to the antibodies, and now we can detect the antigen bound to the plate. And these chemical reactions happen really fast. They're enzymatic, so the results can be obtained in as little as 5 minutes. So antigen test would be transformative in our fight against the pandemic, because that would mean that at the point of care or at your job or in the school, on the athletic field, wherever you might choose, within 5 minutes, you would know whether or not that person is positive. And being able to eliminate positivity in a few minutes would allow a lot of normal functions to go on as they have been. The problem with this is that, unlike some other viruses that accumulate to large amounts in the blood, like hepatitis or HIV, very little COVID-19 virus accumulates in the blood, which means the sensitivity of an antigen test is much, much lower than a PCR test. And that is why it's been so challenging to develop a rapid antigen test. But when that happens, and if it happens, it's going to transform everything. Because again, within a few minutes, rather than a couple of days or several days, we will know whether or not a person is positive. So rapid tests are very useful. The antigen test has been a challenge. We think that we can develop one, but it's going to take some more time. But it points to a fundamental difference between COVID-19 virus and other viruses. So the mainstay of testing is PCR, and that's because it is extremely sensitive, but also extremely specific. And that's in contrast to antibody tests, because you should know that coronaviruses are a large family, and many people have existing antibodies to other coronaviruses, and some of those are being picked up in the antibody tests, which means that some of the antibody tests are unreliable because they're measuring antibodies to other viruses. So we need to make sure when we use an antibody test that the specificity is there. So the gold standard is PCR, and the reason is because it is so very sensitive and exquisitely specific for COVID-19, and that is why millions of these tests have been done around the world in the fight against COVID-19. So I hope that helps you understand what the testing is about. And with that, I'm happy to introduce Dr. Cynthia Groom, the Executive Director of the Action Commission.
Good morning. For over 50 years, the Metropolitan Action Commission has had the privilege of walking alongside the residents of our county, specifically those who have challenges and need help with their rent, their mortgage, with water bills, with services for their children through early Head Start and Head Start, with making sure that our community has the things that we need. We're extremely excited that we're able to continue those services to our community by making you aware of an exciting opportunity today that we will be participating in, that we know is a great need in our community and will make a big difference for those of you who are struggling during this season. Specifically, we are proud to announce that the Mayor's Office, in partnership with the Metropolitan Action Commission, will host a series of job fairs. We recognize how many of our residents have lost their jobs as it relates to what's going on in our city or in our world, really, related to COVID. Today, we're excited that we will have our first in a series of job fairs beginning at 2 p.m., going until 4 p.m. Job seekers can still register. This is a Zoom event, so it allows you to stay home and still have an opportunity to apply for a job. This event in particular involves Aegis Labs. There are positions that are starting at $15 an hour and up. There are no positions paying below $15 an hour. In addition to that, there are positions available through the Metropolitan Action Commission. This information that I'm going to share with you next is extremely important for you to remember, and that's how you participate in today's job fair. First of all, you can register for our event. It is not too late for you to register. You can register by going to the Metro Action Commission Facebook page, and you can go to the Metro Action Commission website as well as the Mayor's Office website. Those websites are as follows. You can simply go to nashville.gov. Or if you're going to the Metro Action Commission website, it's nashville.gov/MAC. If you don't have a device at home that you're able to use, we're excited that we are partnering with Goodwill Industries. Their offices are open today, and you can go to Goodwill Industries at 937 Herman Street and participate in the job fair there. I want you to know how important it is for you not to feel like you're too late or to worry about whether you need to get your hair done or anything else. This is a virtual job fair, and it's an opportunity for you to interview on site. You can interview from your home, from whatever location you're in. Again, you can go to nashville.gov or nashville.gov/MAC to register. Aegis Labs with positions starting at $15 an hour, and the Metropolitan Action Commission. I would be remiss not to mention that this is made possible through our partnership, first again with the Mayor's Office, but also with Nashville Works. This virtual job fair series also includes Goodwill Industries, Nashville State Community College, Aegis Labs, Conexion Americas, and Workforce Essentials. Businesses who would like a similar opportunity are encouraged to please get in touch with our office at 615-862-8860, extension 77411. Employers who are interested in a similar opportunity in the future, feel free to contact us. We hope you'll take advantage of this opportunity. I want to say one more thing. Our doors are still open for those of you who still need help with rent, mortgage, water, and other services. Thank you for this opportunity. We hope you'll join us this afternoon.
Thank you, Dr. Croom. One point of clarification, current public health orders require all restaurants in Davidson County to close at 10 p.m. and not 9 p.m. We'll now begin taking media questions. Let's start with Julia Palazzo at WKRN. Julia?
Good morning. Thank you. A few questions. Excuse me. So I saw a post on social media, a club, I believe the name was Vibes Bar and Lounge. They have a huge opening plan for tonight. But just to kind of tie that to a more general sense, any parties that might pop up on social media for the future, is the health department, is police monitoring social media for any future events, just in light of what happened last weekend, and how you're preparing to monitor those? I also want to know if there will be a special contact tracing investigation into the Fashion House party, and looking for clarification on the citations for the mask mandate. I know it was mentioned it's a Class C misdemeanor, but is the fine still $50? Has it increased? And just other areas that police will be patrolling aside from Lower Broadway. Thank you.
Thank you, Julia. Dr. Caldwell?
Good morning. I want you. Could you repeat the question again, just because? The first question.
Sorry, the first question. So that was about a club that has a grand opening tonight.
I got it now. Thank you.
Okay.
I very much want you to know that we look at social media and that we don't monitor it more than necessary, but we very much look at it to get ideas. But we like people to report to 311, to HUB, to let the police know on their lines that are not emergency lines. And so we will actively now be looking at all of those. Is the next question?
Contact tracing.
Yeah. For the contact tracing, it is very important to know that anybody that was there should absolutely get tested. And we will look at this at a cluster, if possible, the way we do any other contact tracing. And the third question? Yeah. Yes, that's correct.
Regarding specifically the Vibe, I do know Hugh Atkins from the department has spoken with them multiple times, the owners of that place, and so health department, gosh, what day is Thursday? So on Monday, we're already on that case, and I've spoken with those owners, I believe, multiple times. Thank you.
Ian Jung at the Tennessean. You're on the air.
Good morning. How can the city be so confident in these recent improved numbers if our raw testing numbers have declined so much? With fewer test results coming back in the past week or two, are fewer people getting tested, or might there be a backlog of results? If it's less testing, can you share any insight on why that is, and if the city should be concerned that fewer people are getting tested? Thank you.
Dr. Jungier.
So it's a great question. I would say if our test positivity rate was going higher, I would be more concerned. Okay, I think fewer people are perhaps getting tested because fewer people feel that they need to be tested. I still encourage anyone that wants to be tested to, of course, go to our community assessment centers, open 7 days a week at all 3 sites, 7 a.m. to 1 p.m. And if they're symptomatic, of course, go to either come to a hospital or somewhere else. But to your question, if our test positivity rate was going up, that would show there's a higher number of people getting tested that are positive, and so that it's a numerator denominator game. So I'm not as worried, but I do still want people to get tested. And I, and to our knowledge, the backlog actually has gone down. We've got a report from the state that the turnaround time is now about a third where it was a few weeks ago and about a half where it was last week. So I don't think it's a backlog issue per se, but thank you.
Brett Kelman, Tennessean. Brett, are you there?
Yeah, can you guys hear me?
Yes, go ahead.
Okay, good morning. As I'm sure you all know, there was a ruling from the Supreme Court of Tennessee last night that coronavirus will not be considered a valid reason to get an absentee ballot in the November election. I was hopeful we could get a response from that from Mayor Cooper and also possibly from Dr. Hildreth, if he's willing to provide one.
Sure. Thanks, Brett. Mayor Cooper.
Well, of course, it wouldn't have been my decision. Coronavirus is deadly to particularly our seniors, and there should not be any hesitation by anybody in their right to vote, doing it freely, and not have an unnecessary health risk.
Well, this is fairly straightforward for me. I disagree with the decision totally because we know the virus will still be around. The virus is deadly, and as Mayor Cooper said, especially for our elders and those with underlying conditions, to me it seems totally unreasonable to expect those individuals in particular to risk their lives by exercising their right to vote. So I totally disagree with the Supreme Court's decision.
Samantha Max at WPLN.
Hi.
Samantha? Samantha, are you there?
Can you hear me?
Yes, go ahead. We'll move on to Nayeli Alamia at 96.7 FM.
Hi, good morning. Thank you for taking my question. My question is more about MNPS schools. Parents are concerned with the system. The grade, school, and email of each student can be seen by anyone in the system. Students are able to chat with other students while they're in the virtual class. And another thing is if other students are aware of another student's birthday, they're able to access their profile and obtain personal information of the students. What would be Mayor Cooper's address to this, and how can parents protect their privacy from others? Thank you.
No, this seems like a question for MNPS. I mean, you're asking about questions with the network security issue that MNPS has in place for their students, so I'm going to refer your question to Metro Nashville Public Schools. Our last question is from Kathleen Suri at Fox 17.
to do a
Sorry,
phase 3
Kathleen,
vaccine.
sorry, you cut off at the beginning there. Could you repeat your question, please?
Sorry, can you hear me better now?
Yes.
Okay, so we know that there's going to be vaccine trials starting with clinical research associates in Nashville. They're looking for 4,000 volunteers. Can Dr. Jahangir, Caldwell, or Hildreth give us any insight into how credible or safe this trial is, and do they encourage Nashvillians to be participating in this if they meet the criteria? Thank you.
Sure. Let's have Dr. Caldwell come up, and then Dr. Hildreth will address that question as well. Thank you.
We're really excited that there are going to be opportunities for people in Nashville to participate in these clinical research trials. Clinical research trials are so important for us to be able to determine the safety and efficacy of new medicines. And we really need a COVID vaccine as soon as possible. But we want to do it right. So we're glad that Vanderbilt is participating in a vaccine trial. We're glad that Clinical Research Associates is participating in a vaccine trial. And each one of these, there'll be more than one type of vaccine being tested. Each one, anyone who volunteers needs to be able to look carefully at the risks and benefits of their participation. And they will be fully informed of what those risks are. Now, this is research, so yes, there are risks. But the good news is that the studies that are being done in Nashville are phase 3 studies. That means they've already gone through phase 1 and phase 2. That means they've been tested on numbers of hundreds of people to get some general understanding of what the safety as well as the immunogenicity is of these vaccines. So now we enter phase 3, where we're testing it on multiples of thousands of people, tens of thousands of people. And these studies will be going on throughout the country. And the reason that Nashville has been chosen is because of our high number of cases. Because when you look to test a vaccine and to see if it works, you want to be able to test it in a place where there's a lot of disease. So we're really very excited to offer these opportunities to Nashvillians at a number of different locations, but it's up to every individual person to be fully informed and to understand what they're signing up for. But we're really hopeful. Dr. Hildreth will also provide some comments.
Well, like Dr. Caldwell, I'm excited that Nashville will be a major site for vaccine trials in this country. Meharry Medical College is part of Operation Warp Speed, so we're going to be enrolling participants in a study as well. So between Clinical Research Associates, Vanderbilt, and Meharry, there's going to be a robust activity for vaccine studies here in the city. I've reminded everyone that vaccines do not save lives, vaccinations do. In order to get to that point where we get vaccinations, we've got to make sure that the vaccines are safe. And I'm particularly concerned about people from minority communities who have a long history of mistrusting, distrusting, and not necessarily accepting what medical research has to provide. So we have to do a great job of educating individuals, making them understand what vaccines are, what they're not, dispelling the myths. So it's going to be really important for us to have ambassadors who've been through the vaccine process who can help us convince others to participate. So I'm really excited about it, but I'm particularly excited to have the opportunity to have minorities enrolled in the vaccine studies, because again, vaccines do not save lives, vaccinations do, and we got to make sure everyone who needs the vaccine gets vaccinated. Thank you.
Let's go back to Samantha Max at WPLN. Samantha, can you hear us?
I can't.
One more time, Samantha. Let's mute.
Hello?
All right. Samantha, please feel free to follow up with me after the press conference. Those are all the questions we have this morning. I'd like to thank Dr. James Hildreth and Dr. Cynthia Croom for joining us today. The next scheduled Metro COVID-19 press briefing will air on Tuesday, August 11th at 9:30 a.m. Thank you for joining us.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.